Hi, my name is Kimberly Faison, and I am here to present the campaign proposal to you, the stakeholders, for immunization for the Hispanic community. In Polk County, Florida, there were 147 cases of hepatitis A that was reported in the year of 2018. Out of that 147 were children, which was 0.3%. The children in the community are not being immunized, as so are the adults. The reason for this being is that a lot of the people in the Hispanic community in Polk County, Florida, are illegal aliens. The reason these families do not have immunizations is simply because they do not have the education that is needed for them to know how to take care of their health. What I am proposing to you is that we and my program, we want to come up with a campaign to help educate the Hispanic community on how to be immunized and the importance of immunizing themselves and especially their children. They need to be educated on knowing that if they're not immunized, that their children can become sick, they can become sick, and their children cannot get into school without proper immunization. What we also want to propose is a health fair within the community park where these families live. We want to have a free immunization day where we'll have nutritionists and doctors and nurses and clerks and medical assistants to help teach the families and their children on the importance of getting immunized. We also want to have nurses who will be giving out free immunizations to the families and their children. This will allow them to get the immunizations that they need. They will also be supplied with their children's shot records, which will be an up-to-date shot record so that they can enter school. And also in the state of Florida, these children need to have their shot records need to be up to date in order to get WIC checks, which a lot of the Hispanic families are WIC participants. The program also wants to have a $15,000 budget is what we're looking at right now. The budget is going to be around $15,000. $15,000 will supply us with a tent to put in the park. It will supply t-shirts for all of our volunteers, which are going to be the doctors, nurses, medical assistants, clerks. We're going to have computers on hand. We're going to have IT people there setting up computers. We're going to have tables with all kinds of health materials and health brochures, both which are going to be in Spanish and English. We're going to have interpreters. The interpreters, from the last time that we had in health fair, we had interpreters to come in, and some of those interpreters we did have to pay, even though a lot of the employees that work for the health department are Spanish, and they are volunteering their time. The last time we did not have enough Spanish interpreters that were volunteering, so we may have to pay for interpreters. We also will have to pay for the medication to be stored in refrigerators. The vaccines have to be kept at a certain temperature. And with that being said, we need to have refrigerators. A lot of the refrigerators that are available to us now do not keep the correct temperature, so we want to buy new refrigerators to have at the health fair to store the immunizations there for the nurses to administer to the children and their parents. The main immunization that we're really concerned about is the hepatitis A vaccine. And that is, from what I said earlier, is that a lot of the people in this Hispanic community have been diagnosed with hepatitis A. We also have volunteers who are now going out into the community and asking questions, trying to find out what their daily activities are so that we can go back and, find out what may be causing these hepatitis A contaminations, which we already know, which is simply not washing their hands after using the restroom, not washing their hands when handling food stuff, not washing their hands hepatitis A can be contracted in a number of ways. So we need to find out what their daily habits are so that we can teach them the correct way to cleanliness. And cleanliness is something that a lot of people just don't know how to do. And with that being said, we want to teach these families how to be healthy and continue to be healthy, and especially their children. 147 cases within Polk County is quite a bit because Polk County is not a really big county. The county is only 50, 60, 70,000 people. So for one community of Hispanic people, 147 people that are only Hispanic to be diagnosed with hepatitis A, that's a really high number. So the reason for this proposal is to get out into the community, to teach these families the importance of immunization, and to further that education and to help prevent any more hepatitis A infections within their community. With this campaign and this proposal is not only to help the Hispanic community. This proposal will help eliminate the spread of hepatitis A, not just within the Hispanic community, but within other communities as well within the city. These people have contact with more than just themselves. They go to work every day. Some of them work in restaurants. These children, some of them are in school. These children need to be vaccinated because they're in school, and we don't want a spread of hepatitis A in the schools. We don't need a spread of more hepatitis A cases within this community, nor do we want any more hepatitis A vaccinations within our city. So we need to get a containment and get this under control before these numbers go up anymore within the community. The proposal also wants to cover not just the money amount, that's the main reason we're coming to you with this proposal. $15,000 will cover pretty much everything that we need for this health fair and this campaign. We also want to monitor during this whole time, not just during the health fair, but we're going to have people going out and staying in touch, which is going to be nurses, medical assistants are going to be going out and going to these people's homes to do blood work at their home and test them, and to bring the test results back to the clinic and the lab to make sure that they are, not hepatitis A infected anymore. So we're going to include that in our proposal. We want to continue to keep in contact with these patients to make sure that they're continuing to stay healthy and that they're continuing to do what we've educated them to do during our campaign and being in contact with them during this campaign. We want to keep them healthy, so we will be staying in contact with them. And to do that, it's going to cost money. So our $15,000 proposal is what we want to make sure that we can get control of the hepatitis A, to make sure that these families stay healthy, the children stay healthy, their parents stay healthy, and the people that they come in contact with who are not part of the Hispanic community, that they stay healthy as well. This proposal is very important to me and my staff. They are very committed. If this is approved, we will be elated to get in here and help these people. We want to make sure that these children are immunized so that they can grow to be healthy adults. They're children now. We want them to be healthy children, but we want them to continue. We want them to grow healthy, and we want them to be healthy adults throughout their life. Without immunization, they're going to have issues with sicknesses if they are not immunized. And with this program, with us having a health fair, and right now we only have one health fair that has been scheduled. Well, that will be scheduled once everything is approved, if you approve this proposal. We want to schedule a couple more health fairs, and the $15,000 will cover that. Will cover that for us, because if we do one health fair, we already have our tent, we will already have our refrigerators, we will already have our vaccinations, we will already have everything in stock for our next couple of health fairs. We believe that we will probably need to do 3 health fairs to get in contact with everybody and get everyone aware and get everyone vaccinated. We're not saying that all the kids are not vaccinated. As I said earlier, some of the kids are vaccinated. However, some of these kids are not up to date on their vaccination. Some of these kids have not been vaccinated in maybe up to 3 years. And those kids, as I said earlier, and also in the state of Florida, these children will not be able to get WIC without having an up-to-date shot record to take to the WIC office with them. So with this campaign and this proposal to you, we are hoping to reach the Hispanic community within Polk County, Florida. 147 cases of hepatitis A is not a disease and contamination that we want to spread out among the Hispanic community. 147 people is way too many for one small community of Hispanic people to be infected with the hepatitis A virus. With your help, we will be able to get the help to these people that we need, get the materials we need to get to these families and their precious children. And with that, be able to protect everyone that they come in contact with. As I said, these families, these parents, they go to work every day. Some work in restaurants. Some of these kids, most of the kids, they are in school. So as I said, some of these kids do have shot records, but a lot of these kids are not in school at all because they don't have shot records. So the kids who don't have shot records are not allowed to go to school. These children need to be in school. So with this campaign and this proposal to you, we will be able to help these children to be able to attend school with the education for the parents to understand that these children need to be in school. However, a lot of these families have religious beliefs, and a lot of them come in with an exempt form saying that they have a religious belief that their children should not get immunized. That's fine, we respect that, but we have a solution for that as well. We will also have priests on hand to talk to these families, and some of the priests, even though they have a religious belief, they understand that these children, they also need to have their vaccinations. We do have a priest on hand that is willing to come and talk to these families and tell them, you still can believe in your religious belief, but you have to also believe that your child needs to be healthy. And to do that, instead of operating in a religious spirit belief, you need to operate in a fleshly belief and believe that in the flesh that you need to be immunized. You could still be religious. And we have an awesome priest who is willing to do that for us. He's a Hispanic priest, and he not going to charge us anything to do it. So he's going to be a great asset to these parents who have not given their child immunizations. They have not been immunized themselves. Some of these parents are the ones that have hepatitis A. So we need this campaign in order to teach these families the importance of getting vaccinated and clearing up this hepatitis A epidemic within this Hispanic community here in my hometown of Polk County, Florida. Even though I live in Tampa, Lakeland, Florida is my hometown. We have no problem. A lot of my co-workers from Tampa, we go to Lakeland all the time, which is only about 30-35 minutes out. We all hop in our cars and we head to Lakeland. Lakeland is my home. So I'm very familiar with Lakeland, but to hear that 147 cases of hepatitis A in one Hispanic community is horrible and is scary. It's very scary. Very scary. So this campaign will allow us to educate these families. We will have interpreters on hand. I myself am bilingual to a certain extent, so I can help out with the bilingual Spanish families who do not speak English. I can help out with that part. So we have a lot of people that will be on hand to make this campaign work and be a success. We just need you, the stakeholders, to approve our proposal to get this campaign up and running so that we can help the Hispanic community. I'm part Hispanic myself, so I want to help the Hispanic community because I am somewhat a part of them. I want to help the Hispanic community become healthy. It hurts me to know that 147 cases of hepatitis A is in one Hispanic community. So with your help, this campaign and this proposal, if this proposal is approved, I guarantee that we will get at least some of these people. There will be more people immunized in this community in the next 6 months than it was in the past 6 months. So we thank you. I thank you for your time, and I hope that this proposal is approved so that we can help the healthcare industry, help these families in the Hispanic community become healthy and stay disease free. Thank you.